It's known as a silent killer. Esophageal cancer claims the lives of nearly 16,000 people every year, but survival rates increase with early detection. Let's welcome our guest, Caroline Brennick, who lost her husband just a month after his diagnosis. She's also an advocate for the Esophageal Cancer Action Network, or ECAN. Let's also welcome Dr. Craig Lockhart, board member of ECAN. Thank you both for being here with us. I'm so sorry for your loss.
Thank you.
So, goodness, he passed away one short month after his diagnosis.
Very shocking.
Were there no signs?
Not in his case, really. He never really suffered from any kind of indigestion or heartburn, and we were very active. I mean, I love to cook, so we ate a lot of home-cooked meals. We went to the gym regularly. We loved to travel, and we did a lot of traveling.
And he was young, too.
And he was young. He was 56.
56
Yes.
years old.
But I was saying to Dr. Lockhart that he was also a New York City police officer who had been working during 9/11, and his death had been deemed a 9/11 related cancer death.
It's interesting. They say that more people have passed away after 9/11 than those who actually perished in the attacks. And because of, so you think it might have been an environmental factor?
Yes, he was posted on the Brooklyn Bridge for a number of weeks after that day, and we think that's really where it started, and it just kind of lay dormant, I guess, which happens to a lot of other, first responders, and it went from there.
Dr. Lockhart, so typically it's asymptomatic esophageal cancer. How do you go about screening for it then?
That's an excellent question. We don't really have standard screening for esophageal cancers. We have 22,000 cancers of the esophagus diagnosed every year in the United States. It's not one that is easy to screen for because it's an invasive test that does require an endoscopy. So there aren't screening procedures in place specifically for esophageal cancers in the United States. Symptom-wise, most of the patients show up with some amount of difficulty with swallowing or some expected weight loss, and some people show up with chest pain. For the patients, but as we said, many of the patients, by the time they get to us, their diagnosis is pretty far along. It's not, very few of these patients are diagnosed at an early stage, so we do need to improve our detection techniques to trying to find the disease earlier.
Yeah, because with early detection, you have a far better chance at survival. However, survival is still pretty low, even with early detection.
Yes.
The survival's, if somebody's diagnosed with esophageal cancer, obviously stages jump into this, but only about 20% are alive at 5 years.
I see. You were saying that there was maybe one instance that your husband had some sort of feeling, or a feeling of fullness without having eaten anything.
Yes, that really was towards the end, right before he was diagnosed. He had only one time where he couldn't finish swallowing his food, and it never really happened again. And then it wasn't until maybe mid-August where he noticed that he would eat the smallest amount of a meal, and he could not finish it. He said, I feel like I've had a Thanksgiving dinner.
Oh, goodness.
And we really didn't know what was going on. And we went to the doctor, and he was diagnosed in early September, maybe mid-September. And from there, it was things happened so quickly.
So rapidly, rapidly. So environmental factors versus lifestyle. What is the difference? Is environmental common?
It's common in certain cancers. This one a little bit less so. That's not one of the sort of the top 5 risk factors for this kind of cancer. The top 5 would be, well, being male is one.
Higher rate in males.
Smoking, alcohol, acid reflux, which is one of the big ones that I think, there's so many Americans impacted by acid reflux, and obesity is another common one.
And those two kind of go hand in hand, obesity and acid reflux. So
digestive
issues.
They are linked. The acid reflux is also linked to something called Barrett's esophagus, which is a condition where the cells in the lower part of the esophagus change because of continued acid exposure, and they kind of look different, they behave different, and it can be a precursor for developing cancer.
Looking at the statistics, it's the fastest increasing cancer among American men.
Correct.
Wow. What's the message that you want to tell people out there? I mean, in early detection, the fact that it has to be invasive in order to find it, if it's there, What's your advice to people watching this to take better care of their health?
That's an excellent question. If you have unexpected weight loss or you have difficulty with swallowing, see your doctor, and quite often they'll refer you to a gastroenterologist. If you're undergoing colonoscopy, which is one of the cancers that we do routinely screen for, if you have symptoms of acid reflux and you're having a colonoscopy, tell your doctor about that. Quite often they can do an upper endoscopy at the same time. You're kind of asleep anyway, so they could do that at the same time and at least begin the process of looking for that kind of illness.
All right. Well, I want to thank you both so much for joining us
Thank
and to
you.
share your story.
Thank
I'm
you.
sorry again for your loss, but thank you for sounding the warning. I think a lot of people need to
Yes.
focus on their health and take it seriously.
Yes.
All
Absolutely.
right. We'll be back after this.